A third coronavirus vaccine is being tested right here in Northern California, but UC Davis Health is putting a special call out for very specific patients.
We're talking Latinos, African Americans, and Native Americans, groups that are very hard hit by the virus. CBS 13's Marley Ginter joins us with why some are excited but hesitant to help.
Oh, that's right, they are. And this vaccine does actually have some of its advantages. It doesn't have to be stored at those sub-zero temperatures that the current vaccine does. But of course, it is critical to get these hard-hit communities to test it out. And it will be tough to get some to roll up their sleeves.
Virginia Hedrick with the Consortium for Urban Indian Health made it her mission to raise awareness about the COVID-19 impact on the Native American community since the beginning of the pandemic.
It has a pretty decent coronavirus vaccine tracker.
Now with a new vaccine in the works called Norovax, UC Davis Health wants to prioritize minority groups hit the hardest to put it to the test.
We have seen deaths of our elders and knowledge loss that we'll never get back. And so when we see a vaccine trial including our communities, it means that we have the opportunity to know how it works, how effective it will be.
Participants will have to make several visits over the 26-month study, with some getting the actual vaccine and others getting a placebo. They're also calling on the Latino and African American hard-hit communities to participate.
I think it's a good thing, especially since somebody is out there trying to help these different communities. With the healthcare is just, healthcare is just not so affordable for everybody. So we kind of, fall through the cracks.
As we hear about UC Davis prioritizing Latinos, people of color in these trials, that is incredibly important given the vulnerability of farm workers.
Will getting Native Americans to even get the vaccine be a problem?
Yeah, it's absolutely going to be a challenge. It already is a challenge.
I have relatives that are fighting in the hospital now to overcome that. So we have to make sure that our voice is being heard.
Assemblymember James Ramos, the first California Native American legislator, says getting people to participate will be a challenge, something already seen in the Latino community.
Now, still, UC Davis Health hopes to enroll 200 to 300 participants here locally, but the overall research is wanting 30,000 participants across the U.S. and Mexico. If you want to participate, we do have a link with information on CBS13.com.
All right, good to know. Thanks, Marley.